Hello and welcome to Atheists Talk cable program. Today is June 5th, 2014. I'm Brianne Bilyeu. I'll be your host for the next half an hour. Minnesota Atheists is both a producer and distributor of this program. Our contact information will come up during and at the end of the program. On today's program, we're going to discuss reproductive rights, covering topics such as bodily autonomy, the fundamental right to control and decide what we do to and with our bodies, also birth control, sexuality, sex education, abortion, the right to bear children, legislation surrounding these issues, and other related topics. Minnesota Atheists has a public policy position on reproductive health that can be found on our website, and these are a few of the key points found within. Minnesota Atheists takes the position that public policy should never be based on religious values or superstitious thinking. We hold that personhood cannot be assigned to an embryo or fetus at any stage during development. We believe that social responsibility requires the availability of contraceptives and medically correct information about their use. We oppose abstinence-only teachings. We object to conscience clauses, which permit health care providers to refuse medical treatments on the grounds that they conflict with the provider's religious belief, on the grounds that the actual and intended effect of these clauses is to authorize a religious privilege to permit health care providers to impose their religious beliefs on others. We hold that it is unethical for health care providers to create obstacles to a woman's access to safe, effective, and legal health care. To discuss with me some of the current issues of the day is Tim Stanley, Senior Director of Public Affairs at Planned Parenthood of Minnesota, North Dakota, and South Dakota, and Executive Director for Planned Parenthood Action Fund. He has extensive experience in public policy, lobbying, and electoral planning, tax policy, and state and federal election law as it relates to nonprofit entities. He's a public speaker, an educator, and an ambassador to various medical, religious, and legal communities on issues of reproductive health, abortion, and sex education for nearly 20 years. It's an honor to welcome you to Atheist Talk, Tim.
Great to be here.
Now, Minnesota Atheists writes their policy position from a very specific point of view, namely that basing public policy on religious values is divisive and exclusionary. From a humanist viewpoint, my ethical stance is based on one that values human agency for both individuals and our population as a whole. Why do you, Tim Stanley, the individual, support comprehensive reproductive rights? Anything more than I've already stated?
Wow, that's great. So thank you for the opportunity to be here. And as I mentioned to you at the outset, I'd love to talk about Planned Parenthood under any platform that I have, and that could be to the Minnesota Atheists, to the Minnesota Humanists, to the Minnesota Catholic Society, or to the local mosque. So really just happy to be here and to talk about Planned Parenthood. So I think that for us, or for me personally, I've always believed deeply in reproductive health and reproductive freedom. It's just something that's a core value for me, and I think that in all honesty, it really stems from a very early experience for me working and being exposed to comprehensive sex education at an age that was appropriate for me in fifth grade, and I'll always remember that as being a real landmark event in my life, and one that just sort of made me deeply respect the complex notion that is our human sexuality, but to also be very sensitive to issues around healthy relationships, positive image, freedom from violence, and things like that as well. So for me, it's a deeply held value and something that I believe in clearly. I've been doing it for nearly 20 years. And I find Planned Parenthood to be perfectly in tune with my values. And Planned Parenthood supports, of course, a woman's right to choose, but also more than that, just understands that abortion is a deeply personal and often complex decision, and women need to be supported in all the options that they have available to them, and they need, fair and unbiased and accurate information.
Very good. Now, can you tell our audience from the perspective of someone who's an executive director for the organization, what is Planned Parenthood?
Sure. Well, Planned Parenthood in our region is the largest provider of reproductive health care in our region. We serve 70,000 men and women every year in our 3 states. We have 20 clinics, and those 70,000 patients are augmented by another more than 35,000 people that we teach sex education, comprehensive sex education to in public schools, but also in peer-to-peer counseling, in parent-child retreats and things like that. So we, Planned Parenthood, touch hundreds of thousands of lives every year. We've been in Minnesota for more than 80 years. Nationally, we've been around for 100 years, or actually this next year will be our centennial. And we are, like I said, the largest provider of reproductive health care, but we're also a leading voice when it comes to advocacy and when it comes to election-oriented issues about making sure that we have people in office that support Planned Parenthood's issues.
Now, you just mentioned electoral work and also healthcare. So there is a difference between the 501c3 of Planned Parenthood and the Action Fund part, correct? Can you explain a little bit about that?
Sure. So, Planned Parenthood, or what we call Planned Parenthood Minnesota, North Dakota, South Dakota, is a healthcare organization. It has what we call a 501c3 under the tax code, and it is able to provide healthcare, often subsidized healthcare, with state grants, with federal government grants, with some county funding, but also with philanthropy. And people who give us contributions to be able to provide that healthcare get tax-deductible contributions because it is because they are providing healthcare as a charitable thing. So that's simply, that's what a 501c3 is, tax-deductible contributions for a charitable means, which is our healthcare operation. We also, of course, have an action fund, which is what the IRS would call a 501c4 organization, which is a political entity, and that political entity is able to do nonpartisan work, able to do advocacy, both what we call lobbying, so at the Capitol, here in St. Paul, or in Washington, D.C., or Bismarck, North Dakota, but we're also able to interact in elections, and we're able to tell our supporters who are the candidates that support Planned Parenthood's issues, and we can do that with this operation, the 501c4, the Action Fund, but contributions from the outside are not tax deductible, and we cannot use any government funding at all, of course, for that political operation. So that's, in a nutshell, that's how that works.
Thank you for that. Okay, so you mentioned Planned Parenthood's roles in advocacy. You obviously provide healthcare, access, education, outreach. What services do you provide in the healthcare realm? Birth control, abortion, regular gynecological visits. What else?
Well, great. So, well, first of all, you name it. When it comes to reproductive health care and sexual health care, we provide just everything. So the things you mentioned: birth control, annual exams, sexually transmitted disease infections and treatment and testing, breast health exams, vasectomy for men, men's health issues as well. Some of our clinics are able to provide well women visits and blood pressure and diabetes check-ins and things like that. So we are, basically for many women, we are their fundamental healthcare touch point, and we are an operation that just we love that about Planned Parenthood, and many women trust us for generations, that their mothers went to Planned Parenthood, they go to Planned Parenthood, and they bring their daughters to Planned Parenthood.
And anyone can seek out Planned Parenthood services, right? I mean, I've had people say, well, I can't go to Planned Parenthood because I've got insurance through my employer, but that's simply not true, right?
Excellent question. Right. No, not at all. Planned Parenthood is, the vast majority of people that come to Planned Parenthood are eligible for service at basically no cost. However, we are able to take commercial insurance, what we would call commercial insurance, and under the Affordable Care Act, otherwise known as Obamacare, more and more people have commercial insurance, and we are happy to take patients with commercial insurance, but we are also happy to take people who are on any kind of one of the public programs or do not have insurance at all. We do not turn anybody away. That is what I think Planned Parenthood's main mission is, to be there to provide health care for people who need it, and we work out the costs when it comes to that time. But we want to be there for people when they need us.
Sure. And I think a lot of people associate Planned Parenthood with avoiding unintended pregnancies, but it really is a healthcare organization. What has Planned Parenthood done, or what do they do currently to support those who want to have children? Because the right to have a healthy pregnancy, to bear children, to raise a family is just as fundamental as the right to not have children, to make your own decision about childbearing.
Yeah.
So what can Planned Parenthood do for those people?
Yeah, so it gets back to what I said, that we very much support, and in fact we only give unbiased, accurate information to a woman when she's experiencing an unplanned pregnancy. That is something that is very important to us. It is our mission. We make sure that the decision whether to bear a child, to terminate a pregnancy, or to choose an adoption plan is something that's deeply personal and needs to be supported no matter what. And so we have very able and very competent counselors that work with women to be able to help them make the decision that's best for them. We have relationships with adoption agencies. We make those determinations, we help women make those decisions for them. We take our time to make sure that they make the decision that's best for them. Many times, it's just strictly anecdotally. There's no numbers on this, but many times, women come in. They do not know how to handle the decision that's before them, and our counselors and our clinicians help them make the decision that's best for them. And oftentimes it is to choose an adoption plan. And we feel that the state and the government, of course, needs to be in a position where they support women no matter what decision that they make. And so we also stand behind government programs that help women if and when they take their pregnancies to term, and we want to make sure that their families are supported within the social structure of this state.
Thank you. So as the Executive Director of Government, you have a very long, I'm just going to double check, make sure I get this right, very long title here. So you are the Senior Director of Public Affairs at Planned Parenthood.
Yep.
What do you do in your role for Planned Parenthood? What are the sort of efforts that you've been involved in the past couple of years?
Sure. So so two roles. So I'm the director of our aforementioned Action Fund, our 501c4, so the organization that works on elections and in advocacy. But then I also operate and work as the Director of Public Affairs for Planned Parenthood. And so in that role, I work a lot with our grassroots network to make sure that they know how they can engage around the legislature to be able to help decision makers make their point, and to be able to to make the decisions that's best for them. I work a lot on fundraising as well, and then I also work a lot with young people, making sure that our interns know that they have the ability to learn at Planned Parenthood, to make sure that they learn about organizing tactics and about grassroots advocacy and things like that.
So if our audience wants to get involved in supporting reproductive health, there's lots of ways to do it, and you could probably tell them all of them.
Absolutely.
Excellent. Now, this is not your first appearance on Atheists Talk TV. You were here in 2007, which is about 7 years ago. Some of the topics that were discussed then are still applicable. Some things have changed. Some things have changed quite a bit. You discussed at that time misconceptions around abortion, some of the key historical legislation. You called them Roe and progeny. Right. So things like Roe v. Wade, of course, starting us off, and then later decisions like Gonzalez v. Carhart, the Casey decision. Has there been any key legislation at the federal level since that time that has significantly altered a person's right to get an abortion? Right.
So since I was last here, actually just sort of filing through, no, there really hasn't been. And I think the biggest decision that we're waiting for right now, as we sit here now in early June of 2014, is a pending decision by the Supreme Court around what we call the Hobby Lobby case, which could really change the overall structure of healthcare delivery in this country. And it basically, what's at issue is essentially the contraceptive mandate within Obamacare, and Obamacare is the Affordable Care Act, and it said that preventative health care must be covered by all insurance companies, and that underneath that preventative care is something called the birth control mandate, making sure that all health plans offer birth control without a copay to a woman. And some privately held companies that are owned by very religious people have decided that they are going to take that case to the Supreme Court and say that it's against their constitutional rights to have to supply birth control to their employees. And so that is probably the biggest case that we're waiting for right now. And it is just really remarkable that we are sitting here in 2014 thinking about birth control, not for the access not further expanding. And it's, since 1965, since the Griswold decision, there's been nothing but essentially expansions of reproductive health care access, especially around birth control. And the benefit of having women have access to be able to control their reproductive lives has been remarkable. Just a couple stats that I just saw. So since 1960, when actually the birth control pill was first patented and approved by the FDA, the number of women who have graduated from 4 years of college has multiplied by 6. Right? The number of married women in the workforce has doubled since 1960. Just because they can control their reproductive destiny. That is sort of just remarkable that 40 years later we're having this conversation around birth control access, and can an employer or a boss be able to tell a woman what kind of health care that she can get? And we think that this is going to be just a landmark case, and we're all just waiting and seeing what the Supreme Court says.
Well, let me ask you about that, about the loss of rights or the attempted limitation of rights that we've seen in the last couple of years. It seems like in the past 5 or 6 years, during that time I've been involved in, been aware of reproductive health and reproductive rights issues. It seems like there's really been a ramping up of attacks against women, against legislation, a chipping away of everything that will support birth control, abortion, basically a woman's right to decide her reproductive fate.
Yeah.
Do you know why that is?
I wish I did. I think, and I've talked to this to a lot of people. I mean, I guess I feel like it's sort of what I've seen in my 20 years is sort of just kind of an ebb and flow or a peak and valley of the agitation around sort of interfering with women's reproductive lives. And sometimes it goes all out. When I first started in this movement, it was very much targeted at the actual abortion providers, and we saw very aggressive picketing at clinics, and we saw picketing at doctors' homes and clinicians' homes and providers' homes, and it was, that was sort of like the peak, of that agitation.
And we are still seeing that now.
Well, we're still seeing that now. I would never want to say we don't, but it's changed just a little bit to now where it is definitely a focus on things like birth control, which many of us thought was a settled issue, and the vast majority of Americans think is a settled issue, and one that when we're in a situation where where birth control use is virtually universal. 99% of women have used or will use birth control in their lives. That is something that it's amazing that we're having this conversation again. So I guess I hope that this is just another one of those peaks, and it's going to recede. But I do think that just a couple of years ago there was a big push to defund Planned Parenthood, both at the congressional level and in some states. And while we didn't see that here in Minnesota, it was something that was really just captured the social conservative movement for several years. And what I always like to tell people is to remember that the federal funding for family planning, what we call the Title X program, was signed into law by a Republican president, Richard Nixon, and was sponsored by a soon-to-be president, George Herbert Walker Bush. So, a Republican. So, it's just a remarkable thing that we're having these conversations. It's just about history will always find a way to repeat itself.
Sure. One of the things that I'm a little bit ashamed to say I didn't know at the time, I didn't know my history as well as I thought I did, that Roe v. Wade was a 7-2 decision.
Yeah.
It was not hugely controversial at the time. It was, you didn't really want to be associated with the the minority there that
Yeah.
didn't want to show their support of
Yeah.
women and support of reproductive health access. So.
Yeah. Yep, that's a really good, no, it's a great memory. And in that, since that time, since 1973, the number of justices that would stand up and defend a woman's right to choose in Roe and all the progeny decisions since then has just slowly fallen from 7 to 6 to 5, and that's where we are now at 5,
Yeah.
but it's close.
Yeah. One more blast from the past, if you'll indulge me. You reintroduced me to a quote that I had heard a while ago. This came from Justice Blackmun in his opinion of the court, from the court in Roe v. Wade. He said, "You need not resolve the difficult question of when life begins. When those trained in the respective disciplines of medicine, philosophy, and theology are unable to arrive at any consensus, the judiciary at this point in the development of man's knowledge is not in a position to speculate as to the answer." Mm-hmm. I'm seeing a lot of arguments for personhood these days. In the 7 years since you've been here, have you heard anything convincing?
Yeah, I haven't heard anything convincing, and in fact, the public debate has only grown, on that issue. We have seen it happen in state legislatures, and 2 states have had personhood on their ballot, in Mississippi and Colorado, and right now one of our states, North Dakota, is going to have it on the ballot as well this coming November. Right. So I've only seen the public debate grow. I have not been convinced that we have any settlement of that matter, and the judiciary, is not in a position or just not being called on to answer that question yet. Sure. So anyway, I have not seen a convincing answer, but it's going to be something that is going to keep coming up, and because the opposition is relentless, and they're going to keep at it.
There is something that I'd like to get out there to the universe when it comes to personhood. There is actually a secular pro-life faction. It's very small, and I think that's surprising to a lot of people because it is so often seen as a Christian, religious, conservative viewpoint. But the idea is that the conceptus is human. It's not necessarily ensouled, like some Christian activists might say, but the idea that the sperm and the egg coming together is a human thing and therefore worthy of being supported. And there's been a lot of really good answers to that argument, and I don't know if
I have not heard any of those. I have not heard those. Yeah, no, I haven't heard any of those. But yeah, no, I mean, this is a debate that is going to outlive us, all. Yeah. It is going to be around, and for us, for somebody like me who has dedicated their career to working in this field and to defending a woman's right to make her own most personal and private decisions, that it's going to, all I can really help to do is just to make sure that that women have the services that they need, that there are people in place to be able to continue to do the work when I'm no longer doing the work, because it's going to be a debate that's going to continue to divide this country. I have no doubt about it. However, the numbers have pretty much stayed the same, that there is a majority in this country that is not comfortable with government interacting or interfering with a woman's, right to make this most personal, very complex decision on their own, that the people are just not comfortable saying, or they are, basically just saying, I cannot make this decision for somebody else. I am not in their shoes.
And that's on both sides of the aisle. That's,
yeah. Oh, I agree. Yeah. Yep.
Like you said, majority.
Yep.
Let's see. We've got about 5 minutes left. One last question I wanted to ask you, back again from your interview in 2007. Yep. You said that it could be possible to work together with the anti-abortion lobby to keep women from being in the position of having an unintended pregnancy. It sounds like a great goal, right? If unintended pregnancy and limiting the number of abortions is the goal, then we might be able to find common ground. But I have to ask you, do you believe that it's possible? Can we build a bridge between reproductive rights advocates and anti-abortion advocates, especially with the recent attacks on birth control and sex education? These are the very tools that we would use to reduce the number of unintended pregnancies. So is there a bridge to be built?
I always have to remain hopeful, because that's what we try to do, and I always believe that that people do understand that the best way to prevent in unintended pregnancy is through education and through contraception. It is, and again, I think that is supported by the vast majority of Americans. I have to remain hopeful because that's what we do, and that's what we're all about. And I think that it can be done. And what are we trying to do about it? I mean, I think is we're always trying to make sure that people understand that comprehensive sex education for young people is not related to the greater frequency of sexual intercourse or to greater promiscuity. In fact, the complete opposite is true. And so I believe when the facts get out, we're able to kind of have that conversation.
How are we doing on comprehensive sex education in the public school system in Minnesota now?
Well, in Minnesota, there's not a mandate from the state. It is taken at a school district by school district level, and that is, for many people that works, or for many young people that works if they happen to be in one of those schools, and for many people it doesn't. What is interesting, since the Obama administration came into office in 2008, they have been funding both abstinence only as well as evidence-based teen pregnancy prevention services. Now, the many people would say it's a shame that they have to do any of the abstinence only, but the fact that the federal government is taking some of its resources and applying it towards evidence-based teen pregnancy prevention is a very good thing. And that, of course, was not happening under the George Bush administration. So we are very appreciative of that, and that we are using some of those resources actually in Minnesota and in North Dakota to be able to make sure that at-risk youth have the lessons that they need to be able to lead healthy reproductive lives.
I want to circle back really quick since we have just a little bit of time to fill. You mentioned that Planned Parenthood has 20 clinics in our 3-state area, but most of those are concentrated in Minnesota, true?
Yes, correct. Yep, 18 of our clinics are in Minnesota.
One in each of the others?
Yep, no, sorry, 2 in South Dakota, and we actually do not have any clinical services in North Dakota right now. And then just many people ask that we, the vast majority of our clinics are also just family planning clinics. They do not provide abortion services. Our St. Paul clinic is our primary abortion provider, and that's right there on just off University Avenue.
Sure. Yeah. So we might talk a little bit more in our second segment about why we have such a dearth of clinics in those other states. Let's see. So we talked about the services that Planned Parenthood offers. Can you just tell our audience about the 3%? We hear about 3% of services go towards.
Sure. Yeah. So the numbers actually for us, and it varies a little bit, but we like to say that 95% of the services that Planned Parenthood provides are not abortion. You know that. So 5% are abortion related, and so 95% of those services are everything that I talked about. So the 70,000 patients, the 35,000 education contacts that we make. Sure. That is what we do, and we definitely provide abortion, and we're not ashamed of that. We're very proud of that, but it does account for just over 3,000 patients in a year. So that's the 3 to 5% we'll say.
Sure, thank you. We do have to wrap up here though, unfortunately. Thank you to everyone for watching. Our contact information will be in the credits, will be after the credits. You can go to our website, sign up for the Atheist Weekly emails, look for our Facebook pages, request a sample newsletter. Got one here. We can send you that by mail. If you're interested in us, we are interested in you.